The World Health Organization Handbook on Healthcare Waste Management defines healthcare waste as all waste generated within healthcare facilities, research centers, and laboratories related to medical procedures. In addition, it includes the same types of waste originating from minor and scattered sources, including waste produced in the course of healthcare undertaken in the home, like home dialysis, self-administration of insulin, recuperative care, among others. Mulago Hospital receives up to 2 tons of health equipment and drugs quarterly from the National Drug Authority. This, in turn, leads to a high generation of waste, both domestic and medical waste. Waste generated from Mulago Hospital is categorized and handled separately at the point of generation, according to Sister Christine Seremba, the Principal Nursing Officer in charge of infection control.
We have what we call domestic waste. We have medical waste, and with the medical waste, we also go ahead and classify it again. We have infectious waste, we have toxic waste, and the sharp waste. We really try to make sure that we keep our waste properly so that we don't cause problems to the community around us.
Sister Seremba says this is done in accordance to a national policy of healthcare waste management.
We use coded bins. Each type of waste, we give it a separate color so that it's easy for people to identify that you know this color is for this specific.
Enoch Kusasira, the Public Relations Officer, says the hospital has hired service providers to have the waste collected in time.
We have a service provider that collects medical waste and takes it to a place gazetted by KCCA. That's where it is disposed. It is called Hilltop. Then we have a cleaning company that collects some of domestic waste and some of the medical waste. Some of it will be taken for incineration, while some will be given to the other companies that take it away. Then we have bio waste. It's another company. For them, they take away or what they call pathological waste.
Sister Seremba says anyone handling medical waste is required to meet the set standards, which include vaccination against some highly infectious diseases like hepatitis B and training, among others.
We tell the contractors their workers should have protective gear, because this is a very sensitive area. If they are not protected, they'll get diseases and they are going to lose their lives.
Mulago Hospital has an incinerator where some of the generated waste is reduced to ash. But Sister Seremba says the current constructions of a new women's wing and several renovations have affected its mode of operations.
We don't have enough space to keep those bins, but we are trying to see that we put them at least in the best areas where they can be. They are not easily reached by other people.
She adds that this also hinders disposal of pathological waste, which includes human tissues, organs or fluids, body parts and contaminated animal carcasses at the hospital premises until it's picked up by the service provider. The spokesperson for the National Referral Hospital, Enoch Kusasira, says more is required to keep it tidy.
It is not easy also to clean Mulago. Clean all the urinal places, or the toilets, the walkways.
Sister Seremba says that the inconveniences on waste management are hazardous.
When these wastes are not disposed of properly, we have children around, even adults. There are people who come and pick those, like syringes. We have people who are keeping poultry. Instead of buying a syringe of 500, he will come and pick the one which is used and goes and injects the what? The chicken. Actually, it has brought problems because now we find that even chicken have hepatitis B.
The Public Relations Officer says the hospital requires an improved budget.
The hospital is so big, the traffic is so high, we need more money in that area.
The World Health Organization Handbook on Healthcare Waste Management recommends that any facility generating such waste should identify locations in the healthcare facility where good waste segregation is undertaken and where segregation practices need to be improved. Determine the potential for recycling and other waste minimization measures. Estimate the quantities of hazardous healthcare waste that require special handling. Obtain data to specify and size waste collection and transport equipment, storage areas, treatment technology, and disposal arrangements to be used. Walter Mwesigye, NTV.